Hello friends, welcome in Dr. Anil Chauhan, our YouTube channel. Today let's discuss on meningitis. Meningitis is the acute inflammation of meningeal layer of brain. In incidence, 20 to 30% die of newborns bacterial meningitis. I share amazing knowledge and amazing facts for you, so continues on video. Cause of meningitis: bacterial, viral, fungal, parasite, protozoals, physical injury, cancer, certain drugs, NSAID. Let's begin. Continuous type of meningitis. In a first, pyogenic, tubercle and aseptic. In a pyogenic bacteria, tuberculum, mycobacterium tuberculosis, and aseptic, viral, fungi and protozoa, parasites. In a first, bacterial meningitis is also known as septic meningitis. Extreme severe that requires immediate care, can lead to permanent damage of brains and disability and death by spread, coughing or sneezing. In second, tubercular meningitis, infection with this bacterium begins usually in the lungs. 1 to 2% of cases of bacteria travels via the bloodstream. In a three layer of the brain and middle layers of meningeal inflammation is called the meningitis. You see on a skin, periosteum, cranium, dura metal, arachnoid metal and pia mater. Meningeal layer should be occur that arachnoid and pia metals is the middle layer. What is the symptoms of meningitis? What is the affections of meningitis in a body? Center, ear, muscular, systematic, stomach, skin, headache, alternate mental status, phonophobia, fatigue, severe muscular pain, nausea, vomiting, painless, high fever, seizure, stiff neck. Sleeplessness is the most indications of stiff neck, with light sensitivity and joint pain. Another clinical features for meningitis described should be continuous on a video. Headache, high fever, nausea, vomiting, photophobia, stiff neck. In an infant and young children, it should be the stiff neck are also absent. Irritability and projectile vomiting may be the preceding features. Let's begin. Differential diagnosis: viral encephalitis, brain abscess, spinal epidurals, parameningeal infections, cranial osteomyelitis, subdural empyema, aseptic meningitis are also. Goes on body cultures, blood cultures, specific cultures, isolated techniques. In a blood cultures and meningitis, H. influenza, Staphylococcus pneumonia. In a specific cultures, isolated techniques, viral, protozoal, fungal meningitis is the suspected. Goes on lab diagnosis: CSF, cerebrospinal fluid examination, histopathology, latex agglutination, polymerase chain reaction, viral culture, rapid diagnosis test, RDT, serological study, other lab study. Most important signs are presenting of meningitis in a body is cervical spondylosis and cervical reticulopathy. Symptoms of stiff neck: cerebrospinal fluid collections procedure by lumbar puncture. Let's begin treatment. Complication measure: subdural effusion, ependymitis. In subdural effusion, subdural pricking and ependymitis, ventricular puncture, drainage. Patient in ventricles be depressed. In clinical, medicals and hospitalized treatments should be continuous in a video. Medical emergency: appropriate antibiotics, use of DOC penicillin under the epidemic condition in African area with the limited health infrastructures and resolution. Ceftriaxones, penicillin, ampicillin, chloramphenicol, ceftriaxone are all the antibiotics stable for meningitis. In medical emergency, treat as soon as possible, ideally after lumbar punctures has been carried out, if such a punctures can be performed immediately. Thank you for watching.